Hi, I am Dr. Martina Anto-Ocrah, and it is my pleasure to speak to you today about some of the work that we have done on the impact of concussion on women's health. Today's topic is From Sex Life to Periods and Pregnancy, the hidden impact of concussions on women. Our story begins with Samira, a 35-year-old busy mother of two who was involved in a motor vehicle crash. She experienced some whiplash and was taken to the emergency department where she was diagnosed with a mild traumatic brain injury commonly known as concussion. She had indeed sustained a head injury, evidenced by the whiplash, but there were no signs of a head bleed, and her Glasgow Coma Scale score, which is a measure of her level of responsiveness and consciousness, was deemed normal. For women like Samira, the treatment plan is rest with limited physical activity to allow her brain to heal. She was expected to recover in 1 month. 2 months later, Samira was experiencing persistent post-concussion symptoms, or PPCS, which manifested as chronic headaches, a form of physical pain, and she was also experiencing changes in her mood, some anxiety and depression. Samira had become a statistic, joining the over 1.7 million adult women living with PPCS in the United States. PPCS is much more prevalent in women than it is in men. When we think about persistent post-concussion symptoms, or PPCS, what immediately comes to mind are post-traumatic migraines, so very intense headaches that almost don't clear. We think about cognitive or fatigue issues, so issues related to memory, as well as intense fatigue. We think about anxiety or mood, so irritability or anger, as well as some anxiety and depression. Vestibular issues also come to mind. Those are related to disbalance as well as dizziness. And in the oculomotor domain are issues that are related to vision, so difficulties with eye and seeing. What rarely comes to mind with regards to PPCS is the impact that concussions can have on women's relational reproductive experiences. For example, the impact of concussions on women's intimacy and sexuality, as well as their pregnancy and menstrual health experiences. Our research shows that concussions have detrimental effects on women's sexuality, as well as their pregnancy and menstruation experiences. Patients have told us about the impact of concussions on their sexual and reproductive experiences using their own words. For example, this patient said, "I had a miscarriage and I'm now struggling to conceive again." Another said to us, "My period is heavier and it lasts up to 10 days. Sometimes I get my period twice in a month." And a third patient has told us, "My relationship with my partner has fallen down due to my lack of interest in intimacy and my lack of will." There's emerging research showing that exercise is actually a much more effective form of treatment than rest is after concussion. However, this literature is not for people like Samira because it is based on children and adolescents, individuals who are athletes or engage in sports-related mechanisms, and the recommended forms of treatment are actually quite rigorous and require multiple in-person visits, making it difficult for people like Samira to participate in. But what if there was an intervention that was tailored for women like Samira, who are obviously not youth or adolescents? What if the intervention could be delivered virtually? And what if there was low, or better yet, no cost? In this study, we will pilot the effectiveness of a brain injury-tailored yoga intervention for women with PPCS. We select yoga because it is a low-impact complementary health activity that combines movement exercises with meditation and breathing to improve physical and psychological pain. We hypothesize that compared to the stretch control group, the yoga group will have lower PPCS at follow-up. And here is what we found when we did our research. When we asked the question, does yoga improve the sexual health of women with concussions? The answer was yes. We found that compared to our control groups, the yoga group had increased scores of about 5.5 points higher on the female sexual functioning index compared to our control group. And this was much higher than expected. We expected the scores to be about 12.03, but the scores actually increased to 17.5, approximating the scores of the control group, which was 20.2. We then decided to do some bonus explorations. We asked ourselves, what about mood? Why did we want to look at mood? Because mood is very common in women with PPCS, and it's also highly correlated with sexuality. So, if yoga improved mood, we'll be killing two birds with one stone. We'll be improving women's mood outcomes, PPCS symptoms, as well as their sexual functioning. Here's what we found. Everything lowered. Anxiety scored lowered for our yoga group compared to our control group. Depression scores also lowered for our yoga group compared to our control group. And PTSD scores also lowered. Even more exciting are the long-term effects of yoga on all 4 domains. At the week 11 time point, scores remained above baseline levels for sexual functioning, anxiety, depression, and PTSD. To our knowledge, this is the first study to test the effectiveness of a physical activity intervention for PPCS in adult female concussion patients. It's a pioneering collaboration between Pitt and 2 concussion-focused community-based organizations. The virtual methodologies proposed are feasible, generalizable, timely, and low burden for the study participants. And our study is a paradigm shift in terms of women's recovery trajectories after concussion. It fills an important gap. And this is important because women have greater vulnerability to PPCS than their male peers. I hope that you found this video informative and ask that you visit our website at www.drmartinaphd.com to learn more about the lab and the research that we do to improve women's health outcomes.